Good afternoon, everyone. A very warm welcome to the session on Innovation Spotlight. In the interest of time, I'll take just 1 minute to open the session. We are, as Pramod already said, Research and Innovation Circle of Hyderabad, also known as RICH. It was established in 2017 by the government of Telangana. The main objective was to facilitate collaborations between all the innovation actors like research institutions, academia, hospitals, industry, startups, and government bodies. We also fall under the aegis of Principal Scientific Advisor, and in that capacity we serve to solve a lot of national and local complex problems. So as Pramod already introduced me, but I'm joined by our CEO, Ms. Rashmi Pimpalle, and also our project associate, Sadia. Yes, please do give a round of applause to them. I also thank Yashoda Hospitals for giving us the opportunity to showcase some of our best startups. We conducted a AI Innovation Challenge for this, for which a jury involving Dr. Ishwar Nanduri from Yashoda Hospitals and Pankaj Diwan from Idea Labs have kindly dedicated their time, expertise, and selected 4 out of 65 applications. So give it away for our first startup. Salset Technologies Private Limited is represented by Mr. Narayan Rao Garu. This floor is yours.
Yeah, good evening, everyone. I'm Narayan Rao. I'm the founder and CTO of Salset Technologies. The product what we have is Swasa, which is primarily used for screening and triaging of respiratory diseases. All that what we require is a smartphone. The person has to take a breath and give the cough into the phone, and then based on that we will try to detect whether there is any abnormality in the lungs. Okay. So basically during that fireside chat, there was a question like, if there is one question, Prime Minister calls Dr. Karuna and says, one thing you have to do, what is that you are going to say? So if I were Karuna, I'll say that deploy Swasa. We can actually screen 1.4 billion people just being at the home at no cost, but by saving 40% cost reduction for respiratory diseases. So as I mentioned, access and cost are really the 2 primary problems which we are addressing through Swasa. And the 5 big respiratory diseases in India are COPD, pulmonary tuberculosis, asthma, lung cancer, and upper respiratory tract infections. And more importantly, India has the highest burden, and that's where devices like Swasa are needed. So we use cough, as I mentioned, as a marker in detecting the underlying respiratory conditions. So we are actually, one of the organizations which has the world's largest database of cough sounds. We have collected through our partners, AIMS, CMC Vellore, and even with UCSF. And essentially using Swasa, we are actually cutting down, there are no consumables, and you don't require any accessories, and the patient can also do the test by being at the home. As I mentioned, all that he has to do is just take a breath and give the cough. When the person is actually taking the breath, the pressure is getting simulated and generated, and then that is actually triggering the cough receptors which are there in the respiratory system. Based on where the receptors are, the sound is coming out with a certain characteristics. That is what actually we are decoding, trying to identify what the problem is. So we are basically having the CDSCO license, and we also have a partnership with Google. We are actually using their HealthCare model to make our the algorithm more robust and generalized. So the way it works is that, as I mentioned, the patient has to use the phone and then just maintain a distance and then give the cough. And then based on that, we will try to detect whether there is any underlying abnormality in the lungs. And if it is it because of some obstruction in the airways, or is it related to lungs not being expanded properly? And then we'll further narrow down whether there is a chance of having COPD, pulmonary tuberculosis, or asthma. Yeah, we have done multiple validations in India. Basically more than 8 validations we completed. And definitely in terms of detecting normal versus abnormal, we are actually 89% accurate with a very high sensitivity, which is what typically required for any screening device. Yeah, basically we have an IP and we have established evidence. Yeah, I mean, one thing which I just wanted to tell you that the impact what we could generate through this product is that we recently deployed in one of the district in Andhra Pradesh with the help of our state government, and we could screen 8,000 people in about 6 weeks, and we have identified 11 pulmonary tuberculosis cases, and out of those 11, 36% of them are asymptomatic, which is very difficult to catch using the regular, the traditional screening mechanisms. In addition to that, we also could help in detecting COPD and asthma for 50% of those people who have the risk for having pulmonary tuberculosis. Thank you.
Thank you, Mr. Narayan Rao Garu. I now invite Anshul of RAD AI to give the presentation. The floor is yours.
So we all know that every year 75,000 women die because of breast cancer, and this is where the system is most fragile. So that's why we build a mammo for doctors, with doctors to give this new not treatment, but a new screening device to them. So the problem is that the breast cancer care itself is a chain. We start with the mammography, and that leads to other sequential chain, which makes the first read the most consequential. If we are here wrong, then the surgery can be delayed 6 months or 1 year down the line. So currently we are seeing 175,000 cases of breast cancer every year. The number is more higher when it comes to abnormality. Currently we have no national-wide screening programs in India, severe radiologist shortage, and we know that 2 doctors does not agree on the same reports, and we faced this problem when we were developing this software. So we built MammoQ. So this is the user interface that we have, which radiologists actually use, where we have all the 4 views situated simultaneously together so they can reason over it. It generates bilateral assessment, actionable versus non-actionable insight, breast density, mass calcification, lymph node, and skin thickening at pixel precision, as well as generates at the end a BI-RADS align reporting. So moving to the live demo that we have. So this is one of the validation tool I use personally to see how the models are functioning very well. So this is one of Indian patients that we have on our test cohort. As you can see that it's able to detect vascular calcification with 78% of confidence, 50% of confidence, as well as if I use the mass criteria on, which is one of the feature, it filter out all the false positive, and as well as for this patient, we have skin thickening as well. For another patient, this one, we have mass as well as calcification, which is very little. And changing the data set to something which is European. So Embed is an open source data set with 22,000 patient cohort. The software works here as well. So since the time is short, I'll cut to the key features of the software. So we have visual cues, as you have seen, which leads to confidence scoring. So the doctors can see which findings to prioritize, as well as take input from the AI and prioritize that particular patient for future visits. As well, so the software feature PACS integration, so your data does not leave the hospital premises. It has a retrieval layer that pre-processes the data itself, so machining layer difference from GE, Samsung gets filtered out, and artifact filtering. So the data is model ready, so it does not get bad. Then we have a multi-view reasoning system as radiologist 2, and then generate a structured report. So these are the results on our current testing, include 5 different data sets which feature around 11,000 breasts. We have an accuracy of 88.72 and a specificity of 92.44. For FGT, we are currently doing high versus low. We are pretty accurate at that. For A versus B versus C versus D, we are at 80% of accuracy, and we are improving on that. For mass pixel level precision, I have an accuracy of 84.5 with a sensitivity of 89.3. In artifact, we are almost perfect, and we are currently detecting implants, triangular markers, circular marker clips, as well as devices such as pacemaker, which can affect models' output. So these are the roadmaps. We are doing early deployment in multiple hospitals. and we are going to take doctors' feedback and improve the system speed and scalability, and include other pathologies such as nipple retraction and expand on mass, so better BIRATS reporting, as well as at the dream we have is longitudinal study of abnormality. So currently it's taking one timestamp at consideration. We want to take it previous as well as do a future prediction of what that abnormality can become. We are RADI. We are a spin-off from IIT Bombay and Max Healthcare. These are some awards that we won, and contact us if you want to run some pilot study with us. Thank you.
Thank you, Anshul. Now I invite Pradeep from Malverse. Thank you.
So, good evening, everyone. My name is Pradeep. I'm the founder of Malverse, Accelerating Molecular Discoveries. So, we are a recent award winners from the GHP Biotechnology and Life Science for the Structural Biology and Molecular Discovery platform. So, our philosophy is basically to bridge the bench to bedside gap, and make precision diagnostics also in parallel with precision medicine, right? Across scale from atomic level to subcellular system and viruses and so on. So there are multiple problems associated with the preclinical studies to clinical stage, and also target identification to characterization, as we know since the morning sessions focused on these, and also the AI biases as well. And there are a lot of publication problems with no raw data availability in the public domain. This is also something we are really dealing with, and reducing animal models as well for human disease models. So we are basically working on 3D biosensors, which we have about 8 to 10x increased throughput, and also customizable quantum dots for disease-specific biomolecular targets. And also this with reduced GPU resource need. That means cutting down the dependency by 10 to 15x, and also precision robotic automation that we are doing. So there is a huge business opportunity across different sectors. We also did a survey globally involving 350 plus respondents. So this is the distribution, like where the need is. So at the core of Malverse is the data integrity and how to make it more democratized, and also how we can reach tier 2, tier 3 cities, and also non-experts. Especially moving towards FDA, IND, these kind of approvals. So we are B2B, B2B2C, and also B2G potential model. So one of the case studies for the E. coli infection, this is a potential gene bacteriophage therapy target. So all of the data that is available in the public repositories is flawed and also biased. So this cannot be picked up by AI. None so far, not even Google AlphaFold, MIT Boltz, none. So using our novel technology of nanotechnology and also quantum chemistry to AI ML combination, we just need 1/10 of the resources or data, and then we can get up to 2.5 or 3.6 angstrom resolution. So we are now working on the FinGenius pipeline, which is a Finnish proprietary database, also biobank agency on 2 different disease categories. So similarly, we want to deploy this for India. So we have a global traction from across continents. Yeah, so that's it. Thank you.
Thank you, Pradeep. Yeah. Next, I invite Mr. Vamsi from ProRhythm.
Hi, this is Vamsi Karatam, founder and CEO of DeepFats. We're into a remote patient monitoring platform and a device. So this is how the device looks. It's a single wireless device which captures all the key vitals from the chest and provides a real-time data to the doctor to take a right call at the right time. So we focus in hospital wards, rooms, and emergencies, ambulances, and the home care. And we have 5 patents where 2 have been granted and 3 are in the process. And we have been funded by IIT Bombay, IIT Indore. Also, we have received a lot of grants, and we have recently got selected in, we got an award from AP MedTech Challenge, and we deployed our solution in 108. We have done a pilot in 108 AP, and we work more towards with distributor network as well as with home care networks, and also with the hospitals. And recently we have received one more award from NXP India Tech Challenge and as well. Any questions for this? We're done. Thanks.